More than 200,000 patients get infections every year while receiving health care in Canada. More than 8,000 of these patients die as a result.
Hi, my name is Laura Gould, and as Chief Clinical Officer and a London Health Sciences Centre staff member, I'm here to talk to you today about the simple act of cleaning your hands. A minimum of 15 seconds of hand hygiene can keep you and our patients safe by preventing the transmission of disease. Patients come first at LHSC, and no matter what your role, hand hygiene is important. We should do everything we can to prevent the spread of infection. One of the most important ways you can do this is to always follow routine practices and wash your hands. Hand hygiene is the single most important means of reducing the risk of infection.
One of the biggest threats to patient safety is something we can't see: germs that cause infections in hospitals. Cleaning our hands is the single most important way we can reduce these infections. Around the world, thousands of people die every day of infections acquired while receiving health care. London Health Sciences Centre is working to improve hand hygiene practices, and we're not alone. We're part of a province-wide and worldwide effort to provide safe and clean care. To fight the spread of infections, the World Health Organization and its partners launched the Global Patient Safety Challenge. Improving hand hygiene is also a priority of the Ministry of Health and Long-Term Care, the Canadian Patient Safety Institute, and Accreditation Canada. LHSC is a strong supporter of all efforts related to excellent hand hygiene to ensure the safety of our patients and our staff.
Healthcare-associated infections can lead to longer hospital stays, long-term disabilities and death, and cost the healthcare system as much as $52 million a year.
Hygiene is everyone's responsibility. We work in an environment that is full of bacteria and viruses. Those of us working directly with patients are more likely to come in contact with bacteria and viruses. However, we all interact with one another. While walking down the hallway, meeting in the cafeteria or conference rooms, the risk is always present. Remember, even if our hands are not visibly dirty, that does not mean they are germ-free. Our best defense is washing our hands, so we do not contaminate the environment, and the environment does not contaminate us.
Studies suggest that healthcare workers clean their hands less than half the number of times they should.
In a hospital setting, it's crucial that we protect our patients and ourselves by cleaning our hands properly. When hands are visibly soiled, it's necessary to wash them with soap and water. This includes taking the time to wash fingertips, between the fingers, and backs of the hands, followed by rinsing well under warm water. When hands are not visibly soiled, there's an even better way: alcohol-based hand rubs. In fact, alcohol-based hand rubs are now the gold standard in hand hygiene.
Hand hygiene remains the primary measure to reduce healthcare-associated infections and the spread of antimicrobial resistance. In our jobs, there's often little time to spare. Alcohol-based hand rubs only take 15 seconds to use. That's less time than it takes to clean your hands with soap and water. In an 8-hour shift, it is estimated that 1 hour of an ICU nurse's time will be saved by using an alcohol-based hand rub. When providing care for patients, 4 key opportunities for hand hygiene help prevent the transfer of germs to patients, ourselves, and others. Patients shed skin cells, which may contain germs, into the immediate environment of their rooms. This area is called the patient environment, and it includes everything within the space defined by the bedside curtain, or the entry door in private rooms, including the patient. Areas outside the patient environment are called the hospital environment. The first opportunity for hand hygiene is when the healthcare worker enters the patient environment. Washing hands at this point helps to prevent transferring germs from the worker's hands or from the hospital environment into the patient space or directly onto the patient. It is important to wash your hands for at least 15 seconds. This protects patients from getting germs from others. The second opportunity for hand hygiene is immediately before an aseptic procedure. This occurs when a worker is opening a device that goes inside the patient, like an intravenous or a feeding tube, or when they are touching any natural opening in the body, such as the mouth. That may provide an opportunity for germs to get inside the patient. The third opportunity to perform hand hygiene is after potential exposure to blood or body fluids. For example, when handling a contaminated dressing or obtaining a specimen. This prevents the healthcare worker from picking up germs and prevents further contamination of the patient environment. The fourth opportunity is when the worker is leaving the patient's space and entering the hospital environment. This protects the worker from germs and keeps the patient's germs within the patient environment.
Soap and water and alcohol-based hand rub are readily available throughout the hospital. Even when gloves are used, we still have to clean our hands before we put them on and after we remove them. We want everyone to feel comfortable asking us if we have cleaned our hands. I'm accountable for me, and I'm 100% accountable for you. It's just a reminder, not a criticism. We always make a point of saying thank you for that reminder.
Rings, bracelets, and long or artificial nails should not be worn when providing care, as they increase the number of microorganisms on hands and increase the risk of tearing gloves.
If a patient acquires an infection, they may have to be placed in isolation to prevent that infection from being transmitted to other patients. Isolating a patient produces several problems. There is no doubt that it increases workload for the staff. Studies have shown that patients that are isolated experience more feelings of anxiety, depression, and anger. In addition, they may experience less contact with healthcare workers and feel uninformed about their care. All of these can have a negative impact on their sense of well-being.
Healthcare-associated infections are the fourth leading cause of death for Canadians, behind cancer, heart disease, and stroke.
Hi, I'm Anna Leeper, and I'm basically your average teenage girl. But about 3 years ago, I was diagnosed with leukemia and lymphoma in my sinus cavity. They took me straight to London Health Sciences Centre, and there I began my treatment. So chemotherapy was the main thing that killed the cancer, but it also killed my immune system. So there was one thing that was done to keep the infections out, and it's as simple as washing your hands. I saw a study that stated there was anywhere from 10,000 to 10 million germs on the typical human hand. And alcohol-based hand rubs can eliminate as much as 99.9% of those germs. So I, at about age 11, made a poster that said, "Please wash your hands so that I don't get sicker." Now, it seems like such a simple task, and it really is. But if you think about it, one person may have seen that poster and washed their hands. That one person could have been carrying a dangerous germ, and that one wash could have saved a life. So please, wash your hands and use alcohol-based hand rubs so that others don't get sicker. Thank you.
A 20% improvement in hand hygiene has been shown to reduce healthcare-acquired infection rates by 40%.
We're all in this together with the goal of protecting not only the health of our patients, but of our own health as well. Hand hygiene begins with you, and it begins with me. Every person who enters a hospital today and does not clean their hands is putting their patients, themselves, and their families at risk. Working together, we can ensure the safety of our patients, our colleagues, and ourselves.